Morning. Welcome to lecture 6 in anatomy of thorax. Our objectives for this lecture is to first describe the anatomy of pericardium, the parts, layers of the pericardium. Second is to identify the surfaces and borders of the heart in addition to the chambers of the heart with their related valves. Pericardium. As you know, the pericardium is situated in the middle mediastinum. It surrounds or it encloses the heart. The pericardium, it is a fibroserous sac surrounding the heart and the roots of the great vessels. And what are the great vessels? These are the aorta, pulmonary trunk, superior vena cava, inferior vena cava, and the pulmonary veins. So it is a fibroserous sac enclosing the heart and the related roots of great vessels. It is located in the middle mediastinum, extend from second to the sixth costal cartilage. What are the parts or the layers of the pericardium? Pericardium, it will be divided into outer fibrous layer and inner serous layer. So the first one is the fibrous pericardium. This pericardium, the fibrous pericardium, is the strong layer. It is the fibrous, strong part of the pericardium. It is adherent or it is firmly attached to the central tendon. This helps to fix the pericardium. Anteriorly, it attaches to the sternopericardial ligament. The fibrous pericardium fuses with the outer coats of great vessels. It fuses with the outer coats of great vessels, as I mentioned, aorta, pulmonary trunk, superior and inferior vena cava with pulmonary veins. This is the outer fibrous layer of pericardium, which is the outer and stronger one. The second is the inner layer. It is named as serous pericardium. It is the inner layer. The serous pericardium consists of two parts, outer parietal layer and inner visceral layer. Between the outer parietal and inner visceral layer, there is slit-like space named as pericardial cavity. It is found between the parietal and visceral layer. It is named as pericardial cavity. So it is occupied by a small amount of tissue fluid named as pericardial fluid, similar to the pleural cavity and the pleural fluid. But here the amount is 50 ml, up to 50 ml of the pericardial fluid is considered to be normal or accepted in this cavity. So the function of this fluid or the benefit is to reduce friction between the two layers. So it acts as a lubricant to reduce the friction and it to allow the movement of the heart. These parietal and visceral layer are separated from each other, as I mentioned, but they are become continuous with each other, attached and continuous with each other around the roots of great vessels. So the outer parietal layer become continuous with the inner visceral layer only around the roots of the great vessels. عشان احنا ذكرنا انه الفيسرال والبارايتال layer in the lung also they become continuous with each other around the root of the lung. هون تقريبا نفس الشيء, they become continuous with each other around the root of the great vessels. The pericardial sinuses. طبعا pericardial sinuses, they only related to the serous pericardium. They formed by serous pericardium. There are two pericardial sinuses. One is the oblique sinus and the second one is the transverse sinus. And both are formed by reflection of the serous pericardium. So the oblique sinus, as you see in this slide, it will be formed due to reflection of the serous pericardium around the large veins. And what are the large veins here? As you see in this slide, 4 pulmonary veins, superior vena cava and inferior vena cava. So there will be a recess formed due to reflection of the serous pericardium around these large veins. This is named as oblique sinus. And what is the transverse sinus? It is also like passage, like a short passage, lies also due to reflection of serous pericardium around the aorta and pulmonary trunk from one side and around the large veins from other side. So it is also formed due to reflection of serous pericardium around aorta and pulmonary trunk, الارتريز من جهة, and around the large veins on the other side. So this is named as transverse sinus. What about the innervation of pericardium? The fibrous pericardium has different innervation from the serous one. The fibrous pericardium, in addition to the parietal layer of the serous pericardium, both are supplied by phrenic nerves. But the visceral layer of the serous pericardium has or received autonomic innervation. That's to say, from the sympathetic trunk, receive sympathetic fibers and also receive parasympathetic fibers from the vagus nerve. Heart. The heart, it is a hollow muscular organ, pyramidal in shape, located or situated in the pericardium in the middle mediastinum. The heart has many surfaces and borders. What are the surfaces of the heart? The heart has 3 surfaces. The first one is sternocostal, and related to the sternum and costal, anteriorly. So this is named as the anterior surface or the sternocostal surface. So it is formed by right atrium and right ventricle. The anterior surface formed by right atrium and right ventricle. The right atrium and right ventricle are separated by from each other by the atrioventricular groove, and we will talk about this later in this lecture. So the anterior border, the anterior surface of the heart is formed by right atrium and right ventricle that are separated from each other by the atrioventricular groove. The next surface is the diaphragmatic surface or the inferior. من اسمه diaphragmatic, inferior يعني. So it is formed mainly by right and left ventricles. The right and left ventricles are separated from each other by posterior interventricular groove. This is the inferior or the diaphragmatic surface. In addition to that, the inferior surface of the right atrium at the site of entry of inferior vena cava, when it opens into the right atrium, this small site, inferior surface of right atrium, also sharing to form the inferior surface of the heart. So it is formed by right ventricle, left ventricle, and the inferior surface of right atrium at the site of entry of inferior vena cava. The base of the posterior surface of the heart, or the base of the heart, it is formed mainly by left atrium, which receive the 4 pulmonary veins. Left atrium and 4 pulmonary veins that open into the left atrium. So the posterior surface is formed by the left atrium. The apex of the heart, it is formed by the left ventricle. The left ventricle forming the apex of the heart. The apex of the heart, it is directed, this is clinically very important. The apex of the heart, it is directed downward, forward, and to the left. It is at the level, so it is at the left side. It lies at the level of the 5th intercostal space, 9 centimeters from the midline. So in this region, you can recognize the apex beat. You will look for the apex beat here in the left 5th intercostal space, 9 centimeters from the midline. You can see the apex beat here. What are the borders of the heart? It has 2 borders, the right border and the left border. The right border is formed by right atrium. The left border is formed by part of the left auricle and left ventricle. Chambers of the heart. The heart consists of 4 chambers: right atrium and left atrium, right ventricle and left ventricle. The 2 atria are separated from the ventricles by atrioventricular groove in the coronary sulcus. The 2 ventricles are separated from each other by anterior interventricular groove anteriorly that contains great cardiac vein and anterior interventricular artery. This is anteriorly. And posteriorly, there is posterior interventricular groove. So it means that it separates the 2 ventricles from each other. The heart consists of 3 layers. The outer layer is the epicardium. It is the visceral layer of serous pericardium. هي نفسها, it is the same. It is the epicardium, which is the outer layer of the heart, epicardium. The middle layer is the myocardium, which consists of the cardiac muscle, the tissue of the muscle, the cardiac muscle. It is named as myocardium. And the inner 3rd layer is the endocardium. It is lined by endothelium. So epicardium, myocardium, and endocardium. The atrium, it will open into the ventricle by atrioventricular valve. In the right side, it is a tricuspid valve. It consists of 3 cusps. In the left side, it is bicuspid, consists of 2 cusps only. So the atria, each atria open to the corresponding ventricle by atrioventricular valve, which is in the right side named as tricuspid valve. And in the left side, it is a left atrioventricular valve, or named as mitral valve or bicuspid valve. Now we will talk about each chamber separately. The right atrium. The right atrium, there are 2 parts in the right atrium. If you open the right atrium, if you make an anatomic dissection in anatomy lab for the right atrium. You will open the right atrium and you will look inside, from inside. What you will see? Here, it consists of two parts, the right atrium. One part is smooth, and it is named as sinus venosus. And the other part is rough, and it is named as musculi pectinati. The smooth part is separated from the rough part by crista terminalis. So, two parts, smooth, sinus venosus, and rough, musculi pectinati. The smooth separated from the rough part by crista terminalis. In fact, the right atrium, it receives many openings. It receives the openings of the superior vena cava from above, the opening of the inferior vena cava from below. In addition, it receives the opening of the coronary venous sinus. They drain most of the blood from the heart wall. They open directly into the right atrium. So, the coronary venous sinus, they drain the wall of the heart. Most of the blood of the wall of the heart is drained to the coronary venous sinus, and it opens directly into the right atrium between the inferior vena cava and the atrioventricular orifice. It is guarded by non-functioning valve or rudimentary valve or non-functioning valve. What are other orifices in the right atrium? The right atrioventricular orifice, that's guided by the tricuspid valve. It lies anterior to the inferior vena cava. There are other small orifices. These are just small veins. They drain the wall of the heart and they open directly into the wall of the right atrium, into the cavity of the right atrium. Small veins. There are some fetal remnants that can be recognized in the cavity of the right atrium. There is a rudimentary valve of the inferior vena cava. This is a rudimentary valve of the inferior vena cava. It can be recognized in the right atrium. Others are fossa ovalis and annulus ovalis. These two structures, they are located in the atrial septum. It means the atrial septum, that the septum separated the right atrium from the left atrium. So what is fossa ovalis and what is annulus ovalis? Fossa ovalis, it is just a shallow depression formed at the site of the foramen ovale in the intrauterine life. In the intrauterine life, there is foramen ovale, which is patent foramen. It is opened, allow the passage of the blood between the two atria. This is in the intrauterine life. But after labor, after a while, it must be closed and obliterated. And there is a shallow depression will be formed here at the site of this foramen ovale. It is named as fossa ovalis. And what is annulus ovalis? It is just forming the upper margin of the fossa. This is the annulus. من اسمه annulus ovalis. It forms the upper margin of the fossa. The right ventricle. The walls of the ventricles are more thicker than those of the atrium. More thicker, more muscular. The wall of the ventricle showing internally projecting ridges named as trabecular carnea. It is a muscle band formed like projecting ridges of muscle bundles named as trabecular carnea. There is a moderator band also. Moderator band. The moderator band, this band as shown here, this black, look to the head of this black arrow. pointing to the moderator band. It crosses the ventricular cavity from the septum to the anterior wall of the ventricle. It carries the right branch of the atrioventricular bundle. Right branch of the atrioventricular bundle. In addition, in the cavity of the right ventricle, we can see, as I said, the trabecular cornea, ridges of muscle bundle, the moderator band that carry the right branch of the atrioventricular bundle, and there is papillary muscle. Papillary muscle, conical shape, have their bases and apices. The bases attached to the ventricular wall, and the apices attached by chordae tendineae to the valve, to the cusp of the valve. The tricuspid valve. This valve, it guards the right atrioventricular orifice. From its name, tricuspid, so it consists of 3 cusps. It consists of what, this valve, tricuspid valve? It consists of fold of endocardium. كل الvalve نفس structure, fold of endocardium with some connective tissue. أي valve أنا هحكي عنه. In this lecture, I will talk about it. It has the same structure, just fold of endocardium with some connective tissue. The tricuspid valve, it communicates between the right atrium and right ventricle. It consists of 3 cusps. The bases of the cusp are attached to the fibrous ring of the skeleton of the heart. The fibrous ring of the skeleton of the heart, that we will talk about this later, they give support to the heart. So the bases of the cusp حتى تعطي قوة ودعم وsupport to the valve. The bases of the cusp of this valve, they will be attached to the fibrous ring, which is the skeleton of the heart. But the free edges, لأن هو كل يعني valve, it has base and free edge. The base تكون attached to the fibrous ring, to the skeleton of the heart, هتعطيها دعم. But the free edge من اسمه free edge. The free edge is attached to the chordae tendineae. By this, it will be attached to the papillary muscle. When there is contraction of the wall of the ventricle, contraction of the papillary muscle, this will tract the or pulling the chordae tendineae. chordae tendineae يعني connected to the or attached to the free edge, it will close the valve, close the cusp perfectly. Okay. So these are the papillary muscle, 3 papillary muscle that are found, shown here in this slide, found in the cavity of the right ventricle. Pulmonary valve. The pulmonary valve, it guides the pulmonary orifice, right? So it consists of 3 semilunar cusps. It is formed by folds of endocardium with connective tissue. So the same structure, any valve, as I said, it's formed of fold of endocardium with connective tissue. Here, there is no chordae tendineae, there is no papillary muscle attached to this region. But here, in the wall of the trunk, pulmonary trunk, there are 3 dilatations that can be recognized from outside. These are named as sinuses. These are named as sinuses, pulmonary sinuses. There are 3 here. There are 3 sinuses. As the cavity of the right ventricle approaches the pulmonary orifices, it become like funnel shape. منطقة اتصال الكافيتي to the pulmonary orifice that contain the valve. Here it becomes like funnel shape. It can be recognized from outside, named as infundibulum. This is named as infundibulum. The left atrium. The left atrium is similar to the right atrium. But in the left atrium, the cavity, يعني أقصد similar, that the thickness of the wall are the same. But the interior of the left atrium is smooth. تذكرون right atrium is divided into smooth part and rough part, right? Here there is no rough part, it is only smooth part. And they receive the four pulmonary veins, two on the left and two on the right side, two left pulmonary veins and two right pulmonary veins. طبعا left atrium أو right atrium, they associated with auricles. And in the right atrium there is a right auricle. In the left atrium it is associated left auricle. It is just muscular ridges. Just يعني the auricle عبارة عن muscular ridges, right? So but the inside is smooth. Inside the cavity of the atrium is smooth. The left ventricle is the thickest chamber. As I mentioned, the ventricles are more thicker than the atria. But here, the left ventricle is more thicker than the right ventricle. It is 3 times thicker than the right ventricle. يعني here هاي cross section هسه أخذنا. If you look to the right side of this slide, this is a cross section, يعني مقطع عرضي. The left ventricle, it looks circular. هالقد ما muscular. Very thick muscular. While the right one is crescent. Right ventricle is crescent. Right? So the part of the ventricle below the orifices is named as aortic vestibule. منطقة مباشرة هي جزء من الventricle. Just below the orifice, the aortic orifice, it is named as aortic vestibule. The mitral valve, it guards the atrioventricular orifice. It consists, as I said, of 2 cusps. So it is named as also bicuspid valve. تتذكرون tricuspid consists of 3 cusps. والinner structure نفس الشيء. Endocardium, fold of endocardium with some connective tissue. بعد ايش عندنا valves related to the left ventricle. Aortic valve. The aortic valve, it guards the aortic orifice. It is the same as pulmonary valve, but it consists of 2 cusps. The pulmonary valve, 3 semilunar cusp. This is only 2 cusp, right? This is the difference. So it bulge here from the also the wall of the aorta. Again, at the side of the aortic valve, there is a projections, or there are swellings or dilatations, as you want to say. It is named as aortic sinus. This is aortic sinus. ممكن هي dilatations أو نسميها swellings from outside or bulgings. نفس الشيء. Named as aortic sinus. نفس اللي كانت موجودة بالpulmonary همين ذكرنا it has pulmonary sinus. هوني أهميتها. The anterior aortic sinus gives origin to right coronary artery. And the left sinus give origin to the left coronary artery. And thank you very much for today.